Hello everyone. Today we are going to study the topic prescribing symptoms in homeopathy. First we'll see the definition. The condition or symptoms upon which a prescription is made are called prescribing symptoms. The prescribing symptoms are the key symptoms used to select the most suitable homeopathic remedy. These symptoms are individualized and emphasize the patient's unique presentation. Now we will see the key categories of symptoms in homeopathy. The first one is the general symptoms. They relate to the patient's overall condition such as appetite, thirst, sleep, sensitivity to temperature, etc. For example, worse in cold weather, desire salty food. The second one is a particular symptoms. First you will find the localized symptoms specific to part or organ of the body. For example, burning pain in the stomach, swelling in the joints. Next important is the mental symptoms which include emotional and psychological states. For example, fear of being alone, irritability in the evening. Next important is the modalities. Conditions or factors that worsen or improve the symptoms. For example, worse from motion, better from warmth. Now we will see the next one is the characteristic symptoms. Unique, peculiar symptoms that stand out and often guide remedy selection. For example, sensation of a ball in the throat, chilly person but desire cold drinks. Next important is the causative factors. Now we will see the steps in identifying prescribing symptoms. Most important thing is a case taking. Gather detailed information about the patient's physical, mental and emotional symptoms along with lifestyle history and causative factors. Next one is a analysis and evaluation. Identify which symptoms are characteristics, peculiar or significant. Focus on complete symptom with clear modalities and concomitant. Next step is a repertorization. Use a repertory, for example BBCR, Kent repertory, Voga repertory to find the remedies that match the symptoms. Next important thing is a consult materia medica. Study the remedies in depth to confirm the match between the patient's symptoms and the remedy's profile. For example, we'll see one example of prescribing symptom. A patient presents with severe throbbing headache is a particular symptom. Worse from light and noise, modalities. Feels better in dark room, again modalities. Associated with nausea, concomitant. Irritable and short-tempered, mental symptom. Likely the remedy is belladonna based on the intensity, modalities and accompanying symptom. Now we will see various types of prescribing. The first one, prescribing on constitution and general characteristics. General symptoms or the constitutional symptoms are the most valuable symptoms because they pertain to the patient to be cured as a whole. General characteristic symptoms consist of general mental symptoms of the patient, general modalities of the patient, general physical makeup of the patient. Next one is a prescribing on characteristics. According to the Bonninghausen, the type of symptoms which constitute the totality of the characteristic symptoms are quase, means the makeup of the patient, quid, peculiar sensation, ub, location of the disease, cure, cause of the disease, qumodo, modalities of the circumstances, conto, modality of the time, cubus auxilius, concomitants of the symptoms. It is the qualitative totality or the characteristic symptoms to be the only one which constitute the totality of the symptoms in real sense. The next one is a prescribing on causation. Immediate cause, for example, diarrhea from meal, constipation after coffee, or remote cause, trace back from the HPC or during the narration of the sufferings. Patients often say that he had never well been since that time. The cause of the disease has to be searched for, because the cause is removed, the effect go off by themselves only. Next important is a prescribing on suppression. If any disease condition is suppressed with allopathic or modern medicine or by external application, then the prescription should be based on suppression. For example, dyspnea after suppression of skin eruptions, rheumatism after suddenly checked diarrhea. Next important one is a prescribing on miasm. Diseases like skin eruption, syphilis, or gonorrhea are normally treated by strong drugs and topical applications. So, they are driven into the system, which in turn cause miasmatic diseases. When a patient is suffering from psoriasis, syphilis or psychosis, or a combination of the two or all the three, the treatment is given as per the miasmatic prescribing. Next one is a prescribing on nosodes and bowel nosodes. Nosodes are medicines prepared from the disease product or any part of the body. For example, or we'll see the few indications. When well selected remedies fail due to interference of the miasm. When well selected remedies does not hold long enough. When patient says that he has never well since that disease. For example, influenzinum in influenza. Bowel nosodes are prepared from the bacteria of the intestinal tract, gut. The indications. When well-selected homeopathic medicine fails due to the poisonous action of the intestinal bacteria, bowel nosodes have the effect of cleansing the system of the poisons causing the disease. The next important is prescribing on organopathic medicine. Certain medicine have the affinity to certain organs of the body. For example, brain, heart, lungs, etc. If these organs are affected, then medicines having the affinity to the corresponding disease organ is taken from the repertory in which it is mentioned. It is useful when there is a paucity of the symptoms. Next important method is prescribing on autotherapy and autohemotherapy. When there is nothing to prescribe upon, but the patient is suffering from some chronic disease for which no homeopathic medicine is found, then any material from the body of the patient, such as stone from the kidney, sputum, blood, etc., can be taken and potentized according to the homeopathic principles and administered in different potencies. Next important is a prescribing on laboratory investigations. In conditions when there is no etiology or symptoms upon which to prescribe, under such circumstances, we have to take the help of the laboratory investigation. For example, blood, urine, etc. For example, increased blood urea, ill serum is the medicine, increased leukocytosis, pyrogen, pus in the urine, urine sediment purulent. Next important is a prescribing on allergy. Prescribing the potentized substance to which the patient is allergic in the crude form. For example, oysters, fish, etc. Next one is a prescribing on tatopathy. This is the process or killing the bad effect caused by the modern medicine with their own medicines. The potentized form of these drugs are administered to the patient who have been harmed by the same drug in crude form. Next most important is a prescribing on the basis of placebo. Prescribe placebo in order to please the patient, to make him feel that he is taking medicine when the action of the former dose either continues or has not taken place. When you are very sure of the choice of medicine and the vitality of the patient is good, if there is no reason to doubt that there is something interfering with the action of the medicine, then the patient has to be kept on the placebo until improvement taken place or new symptoms calling for a change of remedy. Now we will see the concluding part. Effective prescribing in homeopathy relies on identifying and prioritizing characteristic, complete and individualized symptoms. The focus should be on the mental symptoms, peculiar modalities and causation for precise remedy selection. By applying these principles with tools like repertories and materia medica, homeopaths ensure remedies are tailored to the unique need of each patient, leading to holistic and effective healing. Thank you.